I'd like for the committee members to introduce themselves, and followed by I will ask our executive officer to introduce staff.
Ken Maxey, public member.
And I'm Bernice Basti Martinez. I chair the Education Committee. If our executive officer will please introduce staff, and I will follow that with legal.
Thank you, Madam Chair. Elaine Yamaguchi, the Executive Officer. I'd like to introduce Vicki Lyman, our Assistant Executive Officer. And over on this side, we have Jessica Gomez and Margarita Valdez, our NECs, Geraldine Marcino, an analyst with our Education Division.
Thank you. We have also legal with us. If you'll please introduce yourself.
Thank you, Madam Chair. Kenneth L. Swenson, Senior Staff Counsel, Attorney 3, Counsel for the Board.
Thank you. May I ask all of us to please silence your phones? If you will kindly silence your phones. That includes we should not hear it go buzz because you got a text message. Item 3, Pledge of Allegiance, and I'm asking member Ken Maxey to lead us.
And over your hearts. Ready, begin. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And we want to introduce schools who registered, who are present. And seeing as we have 2 guests in our audience, we're going to actually let them stand and briefly introduce themselves.
Miller, Executive Officer of the Licensed Vocational Nurses League of California, Incorporated.
Thank you.
John Petito, Instructor, LVN, Sherman College of Nursing.
Thank you. Welcome. We're very pleased to have you with us. First item of our work agenda, discussion and possible action to make recommendations to the board regarding the current curriculum content requirements for the preparation of prospective practice of entry-level licensed vocational nurses and psychiatric technicians as defined by board stakeholders. And we have staff here to talk with us. Please introduce yourselves again, and we're here to listen.
Jessica Gomez, Nursing Education Consultant.
Margarita Valdez, Nursing Education Consultant.
Okay, so we have conducted the research that was requested of the nursing education consultants. And we did this by holding 4 data collection meetings, 2 in the Northern California, 2 in the Southern California. The stakeholders were LVNs, programs, and facilities that the students do their clinicals at, or where an LVN can be hired. Additionally, and PTs, I'm sorry. And additionally, we have conducted surveys through using the NCSBN, reaching out to all of the boards of nursing across the nation. So, and we have some of the results attached with our report for that. During the data collection, we found that instructors, programs, LVNs, and the facilities all felt like students were not quite prepared enough for entry level, that they were lacking in the soft skills, which would include communication, critical thinking, ethics, being able to work with the different staff members, physicians, and so this is one area that came quite apparent during the meetings that the students are lacking in this. Additionally, there was concern about the OB, maternal nursing, and the pediatric clinical site placements because there is just does not seem to be adequate clinical site placements for the LVNs in portions of the state. One of the meetings that NCSBN held in February was a meeting directly related to LVNs across the nation and the ability for LVNs to be able to get employment and clinical experiences throughout the nation. This meeting was very much supportive in a lot of the information that we found, and that is that the LVN across the nation is not working in the acute care hospitals. There are a few places pocketed in California and throughout the country where they can. OB and PEDS is a very difficult area across the nation for the students to be able to get their clinical placements. And so NCSBN really feels like since the pendulum swings on where an LVN can be hired, that they do need to maintain this information in the licensure examination, that they're not ready to remove this at all at this time. But they are looking at alternatives and different ways that clinicals can be held throughout the nation. So with everything that we've done, we came up with the recommendations that you requested. And these are the recommendations that the NECs and through the data collection we feel would be strong recommendations to help the LVN be prepared for future work. Number one is to maintain the recommended curriculum content as presented in the California Code of Regulations, Title 16, Division 25, Chapter 1, Section 2533 for the VNs and Chapter 2 for Section 2588 for the PTs, not changing the curriculum at all. Number two is to require the programs to evaluate curriculum and instructional plans to identify content that includes leadership and delegation, communication skills with patients, faculty, staff, and physicians, care of the diverse client populations to include ethnicity, religion, communication styles, ethical decisions, and computation of medical doses, math for administration. Recommended changes to the California Code of Regulation, Title 16, Division 25, Chapter 1, Section 2534 for the VNs and Chapter 2, Section 2588C for the PTs is to decrease the ratio of clinical instructors to students from 1 to 15 to a ratio of 1 to 10. Number four, recommend the changes in regulations regarding the faculty qualifications in California Code of Regulations, Title 16, Division 25, Chapter 1, Section 2529C of the BNs and Chapter 2, Section 2584C for the PTs to require a minimum of a master's degree for the program director and a minimum of a baccalaureate degree in health-related fields for an instructor. And 5, to develop regulations that allow the VN and PT programs to provide a portion of their approved clinical hours utilizing simulation.
In regards to the report, I agree with everything that Ms. Gomez has stated. These recommendations resulted also when we looked at our curriculum and they compared it with the curriculum content. The content for leadership, communication, everything is there. The reason we're requesting that they evaluate it is how are they teaching the content so that the students understand and comprehend and can take it from theory to the clinical side. Insofar as the recommendation 1 to 10, that was based also on the fact that it was voiced that the graduates were not prepared And part of it was that the orientations in the hospitals have been shortened, and the amount of work for the LVN and the long-term cares is increased. So by decreasing the amount of students to the ratio of the instructor would have additional time for the students in the clinical setting to prepare them to increase the amount of patients that they're taking care of while they're in school, so that they can transfer to the employment area.
And for number 5, we do already allow some simulation, but we don't have a regulation in our regulations stating that we can use regulations, so we would like to have that added to our regulations.
Anything else in your report?
That's it.
Questions, committee? Comments?
Thank you for doing this. I think this is going to help us make some decisions moving forward that are going to be positive for the state of California.
Thank you.
Couple of questions. Noted that you're recommending a minimum of a master's degree for program directors. Is there any thought about the type or the discipline of the master's degree, particularly because of the expectations of a program director?
Yes, it should be an MSN ED or education.
Okay. And the similar, because you've clarified that for instructors, it must be in a health-related field. Back up to item 2,
Yeah.
the care of the diverse client population. I'm assuming that's not totally inclusive. There's other
There's other areas.
areas to be introduced.
Absolutely. These were the specific ones that were brought up, but it definitely can include other areas.
Certainly in communication styles, not only language difference, but speaking of those with various conditions requiring ASL American Sign Language, for example, not that we assume every practitioner would know sign, but they would be cognizant of the fact they need someone there to translate, just as you would do if they spoke another language. I would add, and it's just a suggestion, particularly as we watch from a national perspective, the interactions, the dialogue that goes on under that client population, gender orientation and preference. We expect our licensees to be professional and to be cognizant of the client's perspective and how they wish to be treated and addressed.
And insofar as the communication during those meetings, it was also clarified that it was not the difference in the language or the accent, but that they understood the content of what the language and what they were instructing others with, that they understood it. There's many words that mean the same thing, and it would be a lot of confusion when the individual or the student is participating in education, that the student understand the content, not that they had an accent.
Okay, I just want to make sure we're talking the same thing. Under 2C, it says the care of diverse client populations. If I'm hearing you correctly, you're talking about in the classroom where a practitioner, a potential licensee, is studying. So if they have positive experiences, hopefully that will translate to positive experiences that they provide for their client population. Oh, okay, I just want to make sure we're on the same page. Thank you. Any other observations? Public comment? If you'll approach, please.
I'm gonna go back so that.
And if you'd be so kind, if you would like, please introduce yourself.
My name is John Vertito. I'm a nursing instructor, Currum College of Nursing. I just want to get clarification on care diverse population. You said a positive comment or a positive environment. I just want to be careful about the wording on that because we are expected to give kudos and back rubs and there's a difference between a positive environment in the classroom and then holding the line saying you were incorrect on giving an injection, incorrect on maintaining asepsis. You have to be able to create some negative to tell somebody that you did it incorrectly. And I just want to make sure that is not what you meant, is that we tell the students that if they're incorrect on performing, that we tell them that they're incorrect performing. And that will create some negative. But in order to move forward, they have to recognize that they made errors and they have to correct it. And I just want to make sure that is, I'm not misunderstanding on
And-
positive input in the classroom.
And staff has a hand up, if you please. You'll need to approach a mic because we do have a potential audience on the other side of the screen.
That was not the intent. That is not creating a negative when you are.
Please speak into the mic.
Okay, that was not the intent. It was not meant during the meetings, many comments were made and discussions. It was not meant that you cannot instruct an individual and say, you made a mistake in the medication, this is how, that was not it. What came up was many times the interpretation that because a student had a different language, they would not be competent enough to understand or take care of those patients. Not the accent, but that they had a different language, English as a second language. That was the intent, to clarify that in order for the students to communicate to their patients, the instructors need to be more cognitive of making sure that students understand the language of the theory that when they are teaching it. Do you understand?
Yes.
If a student asks for clarification, give the clarification. The perception was that when the instructors were speaking was that when they say something, well, are they ever going to understand this? Absolutely. If you explain to them what the meaning is of what you want them to do or what the words mean. Not that they can't be corrected.
Okay, because examples, the letter C versus SEE, SEA. English is a very complex language, I understand, especially with ESL, so I appreciate the clarification. Listening to the presentation, the skills development, I agree. I mean, utmost, being out in the classroom and in the facilities, I'm coming across licensed nurses that are not skills capable. They're asking me or other instructors to perform, show them how to perform basic skills, and they're already licensed. And I have a very serious concern is that schools are teaching to the test, not focusing on the skills. They get the theory, but they are skills poor. And that's a real concern when a licensed nurse comes up and asks me, how do I do a GT tube feeding? Or how do I give medications through an NG tube? And those are some of the basic skills that a nurse, regardless of the level, but at LVNs, should have a working competency to be able to perform these safely and accurately. I agree with the orientation and the ratio is important because some schools pack them in, and having taught 15-1 on a multi-level acute care facility spread out over 5 floors with 3 sections per floor, it's a lot trying to keep track of 15 students in 15 different areas or 14 different areas. As much as I wish we could go back there, we are not in acute care. And our curriculum, our skills are developed more at the acute care level, but we need to hold high standards because schools and students will take the path of least resistance, which means they'll shoot for the minimums rather than trying to hit the maximum. Med math is very serious. We have a population that is not math centric. We have students that are, at our own school, we had school students that we had to move back to another class, drop a cohort, because couldn't pass the math test. And I very much agree with the ethical decision-making and the leadership evaluation. A lot of these LVNs are going into long-term care, subacute, as team leaders and charge nurses, directing care for CNAs and a diverse population, and we have to take a look at these skill levels. So I very much support the recommendations from the NECs and also thank them for the good work they did. As a BS LVN, that's a different population altogether. We have a lot of nurses that are AS, have their associate's degree, but I am not qualified to say whether they're good or bad. But I do tell that a lot of the nurses are competent and are good teachers. And I'd hate to see them lose their jobs and extending their knowledge and experience to the next generation of nurses because they lack a baccalaureate degree versus an associate's degree, but a higher education level above no education, such as a high school diploma, is warranted for the level of what we do. We affect people's lives, and we want to make sure the LVNs in the state of California are still rated some of the best in the nation. In order to do that, we have to make sure that our population meets that criteria. And the safety of our population of California is the job of the board, and I support your efforts in doing this and applaud your support for NECs in making this happen. Thank you.
Thank you. Additional public comment?
Good afternoon.
Good
My
afternoon.
name is Larnie Gallardo. I'm the Program Director for Charles A. Jones Vocational Nursing Program. And again, I want to thank the NECs. They do a very, very good job. Thank you. I totally agree with decreasing the ratio 1 to 10 because if I was the instructor going with the students in their clinical, my license is at stake. And it's very difficult to supervise 15 students at a time. So 10 would be an ideal ratio for me, and I agree with that. I am concerned about the qualifications of the program director and the faculty. The program director having a minimum of master's degree, I would not qualify. But our instructors right now, and mind you, we have a very, very good pass rate with the NCLEX. All my instructors are LVNs. They do not have a bachelor's degree, and they do such a great job. So my concern is these are qualified instructors that do a good job. If I raise the standard for the faculty having a baccalaureate degree, I will have a hard time looking for instructors out there. So I don't know, but it's a good idea to have them, have a bachelor's degree when they are supposed to be teaching. But right now, there's going to be a concern for me because as of now, it's very hard to replace the instructors, and raising the standard of their qualification might make it more difficult for me. Although it will probably be a good thing in the end. But for now, like I said, I have very, very able instructors that are very good, and based on our pass rates, they're really doing a good job. And most of our graduates are gainfully employed in the area of their education. And most of them have gone to higher learning, but again, none of them has a bachelor's degree. So that's one of my concerns. The other thing about the skills portion is that we do not have a time limit from the day that they graduate until they pass the exam. Some of them, they don't take their exams right away. They take a year or two, like some of them go back to their home country, they get married, and then they decide to come back and take the test. And some of them, they can pass the test, but their skills are just like fell out of the wayside, that when they get employed, there are employers out there that express concern, just like as mentioned earlier, they're not very good with their nursing skills because they haven't practiced for such a long time. So I don't know if you will consider it, but we also have a nursing assistant program, which is governed by the California Department of Public Health. And the regulation is the nursing assistant only has 2 years after graduation to take the test. After 2 years, they will no longer be allowed to take the test. They have to go back and be trained again. So just a thought I'm throwing out there. But just the same, thank you very much for your hard work. And I appreciate all that you do. Thank you.
Thank you. Any further comment at this time?
Ms. Gomez, how do other states compare in regards to this expectation in regards to a BA or an MA?
We did not check that out. That we can run a survey to find out through the NCSBN, but this is one of the questions that we did not ask. Our concern is the California's pass rates are one of the lowest in the nation. We want to arm our schools and our students with the best possibility of them passing. And so if we raise the level of our instructors, this was the thinking of the NECs. Also, a lot of our foreign-born instructors, they come to us. Our requirements is that they have a bachelor's degree if they're an LVN. Or there's several ors after that, but some of them have their bachelor's in communication, some of them have their bachelor's in construction, some of them have their bachelor's in news media, which this is why we said in a health-related area. We understand that there are LVNs who have their RN from another country. We do realize that there's RNs that have LVNs that have health-related bachelors, and this is what we think would actually make the better instructor, having a health-related background.
And say we did institute this, what would be the timeline for expectations in schools like the previous lady, I'm sorry, I forgot your name, Larney. What would be the expectation for individuals like that to actually gain that degree, in your
I
opinion?
believe that this would be a decision of the boards. It would not be a decision of the NECs.
Do you have a recommendation?
I do not at this time, no.
I would like to make an observation regarding this. Let me just make sure I'm hearing the concern correctly. Fact, the pass rate is extremely low in the state of California compared to other states. And that's not just for LVNs, it's for all of our licensees.
From what I understand, the RNs is much higher.
Well, the ones that this board is responsible for.
LVNs and PTs, yes.
So both areas are considerably lower than the national average.
There's only 3 states that license PTs, and so we're not able to find out what the other states' licensure rates are for the PTs because it's not a national exam. We have our own exam that's developed here in California.
However, if I recall some of the data that's been placed before us, if once the average has been established, there are schools that are below the identified average for the state of California
Yes.
for PTs.
Yes, there are
So
quite a few.
frankly, we want California #1 regardless of where we're going. And since our yardstick for PTs happens to be California, therefore, I will say there's a concern.
Yes, there is.
So that is a fact. The other is a concern about the level of knowledge as well as practical skill ability upon program completion.
Right.
And then there were a number of other items. I'm just wondering from an educator's perspective, while the degree certainly should bring something more to the table, I'm wondering if it might be what instructors know or are expected to know. For example, strategies for teaching and learning, strategies for using multiple styles of instruction because everyone doesn't learn the same way. And just having a bachelor's degree in a health-related field does not mean necessarily one would know best strategies in terms of helping others learn or in diagnosing what is prohibiting the good learning. And I even say that based upon the reference to the fact that hearsay, some of the individuals in the meetings referred to students who were not first language English speakers as that as being a block to their learning,
Right.
which research shows that is not true. So it further goes to point, what do our instructors know globally? You know, clearly we have some that are doing wondrous things. They are very successful with the students, but from a global perspective, statewide, what are we requiring? And it's a rhetorical question. I don't expect an answer.
I can give
In
it.
terms of teaching and learning. And in terms of program director, a master's degree, I could have a master's degree in a health-related field. However, that does not necessarily make me an educator of educators. It does not necessarily mean I have leadership skills. It doesn't mean I know how to analyze curriculum or to make recommendations about teaching and learning. So I'm just curious how those facts, concerns could be folded in here.
All right, I can answer some of that. With the master's degree in nursing education, this is where the curriculum and the leadership courses are. This is where a lot of the teaching courses are. This is where the director would learn how to utilize a curriculum and develop a curriculum. As far as the bachelor's that we're looking at, when we have a student who is a bright student in an LVN program and they ask a question, if they don't have an instructor who has a stronger healthcare background, such as a bachelor's or even associate's degree in nursing, they may not be able to answer the questions to the best quality for the student to give them the full answer or a higher level answer than what they learned in nursing school or what they read out of the nursing text. And so this is why we were looking at the higher level of educator. With us having such a low pass rate, we thought that this would help bring up the level of face-to-face education that the students could receive.
Both of you bring very good points, and it's points and discussions that we have, because I say, not when we have our discussions, a master's and a bachelor does not mean that you're any smarter or can do it any better. But insofar as when we have the criteria that if you're going to be a director, you must have a course in administration, a course in leadership, and a course in teaching. And curriculum development. If you're going to have if you're going to be an instructor, that's already part of our regulations that we have. People look very good on paper, okay? Even if they have it, it doesn't mean it's going to transcend into what they're doing. What we have done, for instance, what I did was that I looked at the schools and how they are performing, not just their NCLEX, are their complaints, are their issues, and then I look at, these are my directors that have masters. Their students are doing this. They had masters in nursing. They had masters in education. Did it follow? Did they apply what they understood? It doesn't mean the degree alone does it, but we have no other way of evaluating, because we can't go to the schools and tell them, you're going to sit down as a director. Before we make you a director, you have to come up here to the board and demonstrate to us by questions that we ask or interviews. That would be up to the schools when they're interviewing their directors or their faculty, or whether they evaluate them. The other thing that was brought up is that disconnect with the skills. And it's true. Students may be taught the skills, but then, like the other director pointed out, they go off, they don't come back, they haven't practiced them, they go and they sit, okay? The one question we have not surveyed, but we've discussed, and the directors had brought it up, that those discussions were, what guidelines can the state have where there's a limit as to how long a student can be out before they can sit again for the exam?
surveyed them.
Yeah, we surveyed. And there were only a few states, and they do have time limits. We don't.
No, there was only one state that did.
Okay, but we don't. So that's a question that comes up to they tell us also, what do I do if a student, and I don't know, and now that I have to sign their papers because the state says I have to sign their papers, they completed the program, but they haven't been here for 2 or 3 years, and now they'll go take the exam and my pass rates will go down. Those are other issues that have to be looked at. But you made very good points as to the bachelor's, the master's, the associate. But we have the criteria. That doesn't necessarily guarantee it. We were looking at what would provide a better method for these selections. But as you said, we already have that you have to have curriculum, teaching, administrative, and leadership before you can become a director, whether it's you get to have a master's or you have a bachelor's.
So something still is not clicking.
Correct.
Just a reflection. There's licensing of many professionals. In K-12 schools, there's licensing of instructors, classroom teachers. There's also licensing of principals and superintendents. They, in turn, are somewhat like program directors. I just put that out there. And yes, they are required to have a certain kind of degree, and the content of the degree is specified, but just the degree and having coursework in the content does not a license give. Also, there is a foothold or a threshold floor, if I can say, for licensure in community college instruction. Just an observation. Other questions for staff? Comments? Committee, are we at a point where we'd like to make a recommendation to the board, or do we need more information? Is there a time frame on this?
I mean, as I see it, I'm good with the recommendations, but I would like to know what other states are expecting in regards to the BA and the MA. I do believe that and I agree with Madam Chair, in regards to the expectations that we should have upon every instructor across the state of California academically. It is something that I believe will ensure us some opportunities that we haven't afforded ourselves over the years in this department. But I do believe that there are some quality individuals across the state as well that do not have those qualifications, and we need to find a way to include them into this process as well. So let's see what that looks like. But I make the I make a motion.
I move.
I move to make a motion. I move that we accept the recommendations as written here.
And I'll second that. And just for clarification, I believe your motion is that we make this recommendation to the board.
To the board, yes.
Okay, thank you. All in favor, say aye. Aye. Opposed? Abstentions? It carries. Thank you to the staff. We appreciate you very much. Next agenda item. Discussion of possible action regarding the approval of requests to admit students and continued approval reports. This refers to programs with violations or issues that have been identified by the assigned nursing education consultant. This is the first time since I've sat as chair of this committee where there's no school listed. Is that correct? I'm stunned. And maybe it's rhetorical, but can anyone shed light on possibly why there's no schools?
They're getting a picture, we're out there.
Okay. Thank you. Just curious. Next agenda item, moving along. Discussion and possible action to recommend moving the executive officer's report on decisions for the VN and P-Ting programs to the executive committee meeting. We need more information about what this report contains.
Let me provide a little bit, and I will, of course, defer to my experts down the way. Generally speaking, the executive officer is empowered to approve or deny a number of what was referred to as non-controversial, non-complicated decisions. Continuing existing programs, for example. I have been privy to these conversations for now 3 months. The NECs produce very detailed, very fact-based reports of the status of a variety of programs, and I'm presented with them on a regular basis. The discussion with regard to moving that report to the executive committee has to do with a timeliness issue, that as the executives meet every month, this would enable us to be able to communicate more quickly, allow schools to adapt more quickly. Am I stating the case correctly, madam?
Well, was it that you did not feel comfortable doing these, and you wanted to move them back to the board?
I did want to see about making sure that the decisions that were a little bit more in the area of an expert, unnecessarily, as we do not have, for example, a supervising NEC right now. As a layperson, I don't always have that background to differentiate between some certain really fine points, even though, as I said, our staff does a terrific job presenting that. There are a number of decisions that, again, in the interest of timeliness, rather than have them wait for another quarter, for example, to be presented at this committee or to the board itself, that if the decisions were deferred to the executive committee, it would enable us to move on a monthly basis again, but still provide that expert back opinion and guidance. And, obviously we're not recommending a specific action right now, but we wanted to raise it to the committee just for some thought and some discussion so that, we can move forward and create, I think, a better process.
On reflection, it gives me pause because on the item previously, I was somewhat surprised there was nothing listed. And not having any idea what schools or what the questions might be on the proposed list to which you refer, it would be, I really don't have enough information
Certainly.
to speak intelligently.
Okay.
However, it does give me pause to think, executive committee, is that a task of the executive committee? Has the board given the executive committee the ability, has it voted, has it changed its portfolio to allow it to pass on those recommendations when it is the responsibility of the overall board to protect the safety of the California public, which is not only about licensees, it is also about the location and places where individuals are licensed, therefore programs, their curriculum, whether they are placed on condition or have their ability to educate, to practice removed. So I'm a bit lost
Certainly.
and without words at this moment.
I apologize. May I make a suggestion then? First off, your point about the executive committee's charge is well taken. And I know that we are actually in the process of developing our overall committee structure and charges. And should the board desire to do so, they could delegate that decision. They could designate the executive committee with that power. Secondly, of course, your overall point is very well taken, that some analysis, some for instances, if you will, should be presented so that we can, I think, better identify cases in which, your executive officer is empowered to just act on the interim, cases in which we would defer to, say, the executive committee or this committee, and cases in which they would be recommended to the full board for action. Would that?
Well, that would be a good starting point.
Very well. Thank you. But we did want to raise the point, the topic, that so that this is on your radar for future action.
Well, and thank you very much. It would also seem this needs to be on the radar of the full board.
Certainly.
So we would anticipate seeing that as part of the May agenda, or if necessary, and any earlier full board meeting.
All right.
Yes,
Certainly.
thank you. Thank you. Comment? Questions? Public comment? Thank you. So at this time, we will defer any action, and we'll also defer discussion. Item 9, discussion and possible action regarding the restructuring of the continuing education audit process. And I believe staff has something to present or share.
I think a word was added in there that should not be in there, the audit word. What I was asked to present today was how we are applying, having agencies apply to do the the IB and blood withdrawal courses and the CEU courses.
Oh.
Right now, it's all paper, and when we get the applications, they're filled out very incorrectly. So it's a matter of sending letters back and forth, maybe 2 or 3 times. So what is suggested is that we have the checklist, which is with each one of the applications, which specifically pulls out the regulations of why we want it answered a specific way and what needs to be put on the application. We also would like to see this put on the website so that the applicants could apply for it directly, pull it off and submit it electronically and not have it paper. So this would be for the IV blood withdrawal, the blood withdrawal, and CEU courses.
Comment from board members. From committee members.
So, Ms. Gomez, what are you asking for from the committee today?
Actually, just for you to look at the forms and give your blessing that we may go ahead and use this type of way of introducing the applications to the vendors.
I think procedurally, it would be a motion to make a recommendation to the full board that it adopt the appropriate forms and checklists.
What he said.
But before we move to take this to the board, you know, we are a committee, we make recommendations regarding issues related to education to the full board. I've reviewed the documents, and of course, I always put tracking on. I like everything electronic. So I start reading for understanding, comprehension, and then I go into grammar, phrasing, clarity, and I've got some comments.
Okay.
And not necessarily would those be things to discuss. It's, if we are finding that those who are submitting documents are not doing it with clarity and are not including what they need, then we want to make sure the checklist is spot on,
Yes.
directive, and easy to follow. And that was my understanding for the reason for the draft recommendations.
Yes.
Okay.
Yes. So any changes that you can see would be greatly appreciated.
Because they're directives, they
Mhm.
aren't demands,
Right.
but they're directives to help facilitate or expedite
Mm-hmm.
the submission.
Right.
So from a time frame, clearly you'd like to see this done yesterday. That's impossible. Do you believe you could have updated, clean copies for board review by the May meeting?
Yes.
Okay. Colleague, what's your pleasure?
My pleasure is to make a motion that we move this to the next board meeting. And hopefully by that time we will have a document that we have the expectations that the chair has asked for.
Okay. I'll second that. Any public comment? Seeing none? All in favor?
Aye.
Aye. All opposed? Abstentions? We will be moving this to the full board. And the anticipation would be, the checklist would be in a final format for the board's review at that time. Thank you.
Thank you.
Tom, I'm shocked. I'm looking at the agenda. Do I have the wrong agenda? There are no more items?
Would you like to add an item or?
I'm in shock!
You can have a philosophical discussion if you like.
Not necessary. We will take suggestions for future agenda items. And that does include the public. We won't discuss any of these items at this time, but we will make decisions after, outside of the meeting, when and if such items should be added to a future agenda. Please approach.
John Vertillo, Durham College nursing instructor. Thank you for the opportunity to address the committee on this item. I would like to bring to your attention that has been brought to my attention previously in years past when I was a member of the august body. And frankly, I'm not sure when I left if this was able to be evaluated or looked at, but we have reports, or I've heard reports of CEU providers moving outside the area of continuing education. Example, as reported earlier by our NECs, we have a very severe shortage of maternity and pediatrics locations, and people that are trying to go for the Method 3 level of challenging the boards are looking to use CEU providers as a method to circumvent the pediatrics and maternity education requirements, and trying to use CEU instructors that are offering those types of topics in lieu of taking the actual maternity and pediatrics class. Continuing education is supposed to be exactly that, continuing and building on base information, and the actual pediatrics and maternity class is the acquisition of that knowledge. And I think that there are some CEU providers that are trying to use their class as new knowledge rather than as continuing and building on knowledge. And I'm concerned that they're popping up in certain areas in the state trying to use their CEU certificates not as continuing education, but as acquiring new education. And I believe that's a misuse of the CEU certification. And that's something that I'd like to see if we can readdress, relook at, and do some investigation. Thank you.
Thank you. Other suggestions?
Ms. Gomez, just one question. I know we're still on suggestions for next meeting. I forgot to ask, you had spoken a little bit about community colleges, and I was just hoping that you could just say a little bit about community colleges in regards to your visiting some of those community colleges upcoming. Thank you.
We visit not only community colleges, but also our private colleges. It just happens that we are going out on a community college visit. But we are also next week, the following week, going out to two private. So it's not that we're just focusing on community colleges. We're finding issues at a lot of the schools, and so we're trying to, when we're doing the program record surveys for the 4-year continuing approval, we're trying to make it out to really physically visit these schools rather than to just look at paper, which can make it look very good on paper where there can really be some issues.
The reason I wanted you to talk about the community colleges is I believe they're one of our wonderful resources in this state for our educational system.
Yeah.
And I'm hoping that next time we have our meeting that you can kind of give us a more thorough report, particularly on community colleges and what role that they actually are having in regards to our vocational nurses and psychiatric technicians as far as education.
These are items for future agenda, not for discussion at this time. And if it should appear on the next agenda, then such information would be requested.
Okay.
Other items? One more time, any additional items?
Madam Chair, if I may, I do know that the board president and, of course, yourself, we're looking to have every committee involve strategic planning in every committee agenda. I would suggest we add that.
Strategic planning. It was not on our agenda this time, but please,
apologies.
please, if it will be added at the next. Thank you very much. Now I won't say other items again. Thank you. I have to thank the staff particularly thank my colleague, especially and legal, and all of our visitors today in the room. We really do appreciate all that you do and your presence and support of LVNs and PTs and the support and the focus on the safety and security in terms of health of the public of California. This meeting is officially adjourned.